Okay, it's really bright right now, but y'all, I'm going to post more medical records. Proof. I mean, I'm literally at a loss for words because we have proof. Proof that Alexee did not deny the doctor to examine her. What's interesting is if you look at the time at the bottom, this is the same night, right after Alexee was transferred, that the doctor put her notes in the system. Months later, she changes her story. All she said was that Alexee was uncomfortable. We also have the ultrasound report, which I'm going to go ahead and post, and proof that there was no urinalysis ever done because there was never a sample received. So again, I'm posting all of these medical records. Let's go ahead and dive into them and show you facts versus what all these people are saying. And the other thing that's going to get you is she was given a series of other medications. Now, I'm not going to lie, I'm questioning the autopsy because I know for a fact that some of these medications cross the placenta. So she was given these medications, but they didn't show up in the toxicology report. So was the toxicology report incomplete? Or I don't really know how a toxicology report is done, but now I'm questioning it. Oh, and since we're talking about the autopsy report, I also want to add in that there are lies listed in the autopsy report, and we're going to point those out too. So first thing we have here is the ultrasound report. Let's just go ahead and note here that it was originally ordered at 2 o'clock in the morning. And the reason for it was post-pregnancy bleeding. Ultrasound was never ordered prior to that, despite what the doctor said. And what she says in her report too at the end. So we're going to check that out too. Now this is the urinalysis. And as you can clearly see, there was no urinalysis done because there was never a specimen received. Now let's talk about all the medications that she was given. Ketorolac, cyclobenzaprine, morphine, Tylenol, Zofran. All of these medications were given by injection. Now what we know about Ketorolac is that it's a class C drug when it comes to early trimester, but it's a class D in the third trimester and is absolutely not recommended and should not be used in pregnancy. So this doctor didn't even know what she was dealing with, but she was throwing drugs out to this girl. And we also know that these cross the placenta into baby. So why was none of this on the toxicology report? I don't know how toxicology reports work, but I'm questioning, was it complete? Was it not complete? Was it not there? Was it not tested for? Questions, more questions. Now let's talk about this. So Alexee never denied or refused to be checked by the doctor. She was placed in a room and she appeared uncomfortable, according to the doctor. They ordered labs. They gave her all these medications. Patient had a positive pregnancy test. Thus, the quantitative HCG was ordered. She was concerned about a ruptured ectopic pregnancy. She says she ordered the ultrasound according to when the orders were put in. It was hours later, so I don't even know what to believe here. She spoke to them about her period and that the month prior, it was only 3 days. Mother and patient stated prior to that, they were having regular periods. Now, keep in mind, none of this says patient denied having sex. Patient says she was a virgin. None of that is here. Then she says a patient was in the bathroom. She declined to come out. We had to obtain keys to unlock the door. We know that that's a lie because nobody ever made it to that door with keys. Now, the ultrasound showed that there was no products of conception left. So I just don't understand how she was concerned that there was still the placenta or whatever still left if the ultrasound had already cleared that up. So again, Alexee did not deny that she was pregnant. She never claimed to be a virgin. She never claimed to not be having sex. None of that is true. And we have it here in black and white. Okay, y'all, can we have a discussion about everything that was just posted? Now, I do have the unblacked out autopsy report. And the parts that are blacked out are all the parts that we've already proven were lies. So first, let's go ahead and talk about this. I will try to get that other one posted later on, but y'all, we've got to really go over this